Hi guys, so today I wanted to do something a little different. I wanted to do a flashback Friday kind of video, and I realized since it's May, the perfect one to do, because not a lot of people have heard this story, is Eldin's birth story. So as you know, he is 5 years old now, and his birth story, since he was my first one, is just, everything was so new and exciting. But he was born May 10th, 2010 at 10:41 a.m. We had a scheduled C-section because of my brain aneurysm. They didn't want me to go into labor on my own. They were afraid that the stress of labor could cause the aneurysm to rupture. So he was a scheduled C-section due to my safety. So we went in on the morning of the 10th. I think we had to be there at like 6:37, something like that. And so we were there. They took us back around, I want to say like 10:15. They gave me the spinal block, which Blake wasn't allowed in the room when I was getting the spinal block. And let me tell you, like, the worst part of a C-section, in my opinion. I'm sure others will disagree with me, but so the way my spine is, the way everyone's spine is, you have the vertebrae, and then there's spaces or cavities in between your vertebrae, and they have to put it in a certain one to get you to be numb from basically your chest down for the C-section. And come to find out, my vertebrae are really close together. I have very, very narrow cavities in between the vertebrae. And the anesthesiologist was having a really hard time getting the needle into the correct space because of that. He had to stick me, I think, a total of 3 times. At least 2, but I think it was 3. He finally got it, and as soon as like it hit the correct spot, like I knew it, because I instantly got very warm from the chest down into my legs. It was very tingly and very weird. So they got me all set up on that. They had me hooked up to an IV that was giving me fluids and antibiotics as a precaution during the surgery. So I was all hooked up to that. They finally let Blake come in his little gown and everything. And he asked if he could videotape it. They said that he couldn't because of HIPAA regulation or something like that. So he was sitting up next to my head. And yes, so he was sitting up there, and they started doing the procedure. They said that I was going to feel a lot of pressure and everything, and they weren't kidding. When they tell you you're going to feel pressure, you're going to feel like someone is elbow deep in you, which they literally are. You're not going to feel the pain, but it's going to be so much pressure. So much pressure. And so I was feeling that. I felt like tugging and yanking, and it was very uncomfortable. I was getting very hot at that point, a little woozy, and then they said, you know, we're going to pull your baby out now. You're going to feel a really quick pop, and we're going to pull the baby out. So they did, and I felt that pop, and it was so weird, and I heard him crying, and they said, they're like, oh, look, he's peeing on you. And I was like, oh, that's kind of gross. Like, should we let him do that? And they were like, oh, it's okay, we're going to clean you up. So I heard him crying, and they were like, do you want to see him? And I was like, of course I want to see him. And they lifted him up over the divider that was, you know, so I couldn't see them cutting me and everything. So they lifted him up over the divider. later. And you'll see why I had this reaction. I'm gonna post the pictures of when he was fresh out of the oven. My first reaction to seeing my brand new beautiful son was, ugh, because he was slimy and purple and his face looked like it was folded in half. It was horrible. Blake actually did get to see them pulling him out. They at first said that they weren't going to let him look. And then right when they were telling me that I was going to feel the pop and they were going to pull him out, they asked Blake if he wanted to stand up and look. And he did. And later he told me that it was one of the most disgusting sights he had ever seen. So, yeah, not pretty. So they took Eldin over and they weighed him, and he was 8 pounds 4 ounces, and they measured him and he was 21.5 inches long. And let's see, I wrote some notes so I don't forget to mention anything. Yes, so they laid him on my chest after they got him wiped off and everything, and I was kissing him and tears just running down my face. You can't really see it in the pictures, but as soon as they pulled him out, I was just crying so bad. It was such happy tears. So then they had Blake leave the room with the baby. They said he could have stayed with me while I was getting my stitches, but they had to take the baby out to go start doing some of the tests and everything that they do on the newborn babies, and that he couldn't stay in the room for that. So we opted to have Blake go with the baby, and I was left on my own. So since it was a high-risk pregnancy due to my aneurysm, I had a huge staff in that delivery room. I was also delivered by a student practice. So I had the main doctor there. I had about 3 students and probably like 7 nurses, plus the anesthesiologist and the anesthesiologist assistant. So it was a packed delivery room. And they're going through the count and everything of all the sponges and instruments to make sure nothing had been left in me before they started stitching me up. The anesthesiologist was trying to make jokes with me at this point, and that's when things started to get a little, my blood pressure was dropping really fast because I was losing blood. I was hemorrhaging a little more than normal, and I remember just getting very lightheaded, very dizzy, and they started pushing a lot of different things at once through my IV, and it seemed like they would push something to bring my blood pressure up, but then my heart would be racing, and they had to put something else in my IV to fix that, and and so they took me to recovery, and Blake and the baby were in the recovery room at that point, and I finally got to really hold my baby. They propped me up and everything, which the incision was dissolvable stitches on the inside, and then on the outer portion it was the glue, the surgical glue holding me together. I didn't have any outer stitches or staples or anything like that. So they propped me up and gave me my baby, and I was encouraged to nurse, which his latch was incredibly painful. I'll go into more about that later. Basically, the gist of it is he had a tongue tie, and people didn't catch it until a little bit later, like the last day of our stay in the hospital. So breastfeeding was very difficult, and I'd just been through the trauma of the blood pressure crashing and, basically being gutted like a fish and having my child, pulled out of me. And, I expected this magical bond right away. I would look at my baby and be like, oh, life is complete. And I looked at him and, all of my expected sense of fulfillment just went right out the window. It's like, holy crap, this little person depends on me for absolutely everything, and I have no idea what I'm doing. So, it took about 2 months for me to really bond with him and feel that strong, loving connection and felt like he loved me back. So, but it's all great now. He is an amazing child, and I'm so lucky to be his mom. And I think that's it. Yeah, so that is the birth story of Eldin. Of course, I have so many Eldin stories that I could tell you, but since it's May and it is his fifth birthday, his fifth birthday was 2 weeks ago, and yeah, I can't believe it. So I just wanted to get his birth story out there finally. I know, 5 years too late. So I'm going to put some pictures that we took, because we didn't get any video that day, but I'm going to put some pictures at the end. You will see Alien Eldin. You will see the first picture that I took of him in the recovery room on my cell phone. It's the picture that's going to be a little bit dark, and just some other pictures that I really enjoyed from the day he was born. So thanks for watching. Like, subscribe, share, and I'll see you guys for my next video. Bye.